we start trying to define different kinds of psychological disorders, it's worth asking, do we need to do this in the first place? What's the advantage of applying these labels? It turns out there are actually quite a few reasons. The Diagnostic and Statistical Manual, or DSM, is the approach that we use in the United States to define psychological disorders. What the DSM does is it lays out all the criteria that are required to meet diagnostic threshold for a psychological disorder. One advantage is that it increases reliability. Reliability in this context means coming to the same conclusion each time. For example, you and another clinician want to make sure you're coming to the same conclusion about how you're thinking about this problem. You and another researcher might want to make sure that you're studying the same kind of problem. And researchers and clinicians want to make sure they're both talking about the same kind of problem when a researcher is thinking about developing a treatment and a clinician is thinking about whether that kind of treatment is going to be useful for the patients that they're seeing. Diagnoses can also be validating. For people who struggled their whole life with a problem, it can be helpful to finally have a name for it, to be able to say, this is what I'm dealing with. It's not something wrong about who I am as a person, it's that I have this problem. And it gives them a way to look for additional information about their problem and often to find a sense of community for other people who are dealing with the same issues. Diagnoses also matter to insurance companies. Most companies won't offer support for extended counseling or even sometimes brief counseling unless there's a diagnosis showing that the person is ill and in need of treatment. There are also some drawbacks. Stigma is a real concern. For example, people with anxiety disorders or depression are sometimes taken less seriously in medical contexts just because of those diagnoses. A diagnosis also risks implying that there's something wrong with a person. Now, many people with psychological disorders will say, yeah, these symptoms are not fun for me. I would like them to go away. It feels like there's something wrong, and I would like help managing it. And that's the most common. However, there are people who say, these are not distressing to me. These behaviors, these experiences, this is just who I am. I'm different, and that's okay. And I don't want to be labeled as defective or deficient in some way. It's also worth noting that until the 1970s, homosexuality was a disorder in the DSM. Today, we know being gay is not a mental illness. And so it's worth keeping a critical eye toward these disorders. What are our preconceived ideas about what it means to be normal and what it means to be abnormal, deviant, pathological? We want to help people. That's the purpose of ultimately what we're doing in clinical psychology. We also want to understand the world. Diagnoses have some pros and cons for that. The more we study the latent structure of psychopathology, and that means how these variables manifest in the real world outside the artificial labels we put on them, the more we find that these are actually dimensions. These are not categories. So people vary in all kinds of ways across all kinds of dimensions. There's no clear break between what makes somebody clinically depressed, for example, and mildly or moderately depressed. It's an increase in severity. It's not a difference in kind. A challenge for us going forward is to think about how we can get the benefits of diagnostic categories while minimizing or eliminating some of the drawbacks.